the dignitaries, my fellow Ashlenites, greetings to you all. So, Lord Krishna in Bhagavad Gita, he has said that the one who has control over all his senses can only attain true knowledge. That is, he can attain him. But of all these senses, our listening, this is the very pious form of worship to Lord Krishna. But mere listening is not enough. What matters is that to whom we listen. For example, if we listen to our teachers, then we shall get knowledge about your subject. If we listen to music, either we will become calm, quiet, or we will start dancing. If we listen to our parents, our behavior, our responsibilities, these will improve. But if we listen to a man of experience, I claim you will never fail in life. Hence, we always need a teacher, a role model, a guide in our life. It is for this reason that even the greatest of the greatest sports person has a coach. A coach, to him he listens. It is not that a sports person doesn't know how to play. Yes, he practices, but still there is the need of a coach. Do you know that the whole of our life is just the sum of some decisions, our decisions, good or bad, right or wrong, but decisions. But what if I tell you a way in which you can know the outcome of your decisions beforehand, life will be very much easier, right? And in this case, only a successful human being can tell us what actions, what sacrifices, what emotions, and above all, what decisions has made him achieve all these. With all these words being said, what will be the result of listening to a successful person? Result is life transformed and your dreams manifested. And here I introduce the chief speaker of today's evening, a kind-hearted doctor who has received the Young Achievers Award 2018, has been the editor of Odisha Physicians Journal 2017 to 19, has been a member of editorial board of the Journal of Physicians Association of India, and a front-line COVID warrior, and many more achievements yet to say. With all these jewels studded in his crown, he is the undisputed king of the Department of General Medicine. He is none other than Dr. Jayant Kumar Panda, Professor of General Medicine, Sri Ramachandra Bhanja Medical College and Hospital, Cuttack. I invite you, sir, to please lighten the lamp and increase the attraction of this program. And our respected Dean and received the blessings of Lord Jagannath and Agni Devta, and we have made this program very pious and pure. Now our respected dignitaries will be felicitated by the Vice President of our Students' Union 2022, Swastik Das. So let's begin the evening, and we shall begin it by the blessings of our respectable Dean Sir, Dr. Krishna Chandra Biswal Sir. So I request Sir, please come over the stage and share a few words with us.
I might not be knowing Dr. Panda, Jayant Panda. He was here at least for one year or more than 1 year. 1 year. 1 year ago. So generally he was a very good physician with knowledge in diabetes, and he traveled all over India as well as abroad and discussing the topic of diabetes. Now just returned from Hyderabad by Visakhapatnam, giving a lecture on diabetes. Now here he will talk in a just to motivate you. He will give a general talk, not basing on diabetes only. General talk basing on medicine only. So he needs no introduction for us. Only the newcomers, first year, second year. He is a brilliant figure in Odisha, and you must know him. Dr. Panda, Jayant, please come. Actually, when he left this college, we missed him. The people of Koraput sitting in front of there only. So you hope that he will come back again here.
Thank you, sir, for those loving words. It's a excitement this evening in front of you all in the Plexus evening, and I first thank the Students' Union for the invitation and arranging such a prolific evening for all of you. This is the alma mater where I worked, and I remember the day I came and joined. Professor Biswal was there, Professor Mahapatra was there, and then it's the same regulatory authorities, same administrations. In this auditorium we have done many CMEs, and then with students who were available then, we had done many programs on behalf of Department of Medicine and also SLN Medical College. So, coming here, I don't feel that I'm a guest or I'm an invitee. I'm the part of the family, and I respect Professor Biswal's words. I have told my family, my friends, that I never took birth in Cuttack. I had no relation in Cuttack. When I completed my studies, My first posting was SCV Medical College. I came, worked, and I had an interaction with students, with patients, with the soil, with the people around, and I got attached to that place. Had it been Koraput, now I think never I would have left Koraput. It's such a beautiful place with blessing of Lord Jagannath, beautiful nature, beautiful climate. You see, we travel thousands of kilometers for a European country, European destination to get the ambience which you have here every day through your window sill. If you open your window, the sheen you see, the hills you see, the cloud you see, the rain you see, the plants you see, it's just different. It's just different. And I'm sure till now many people in Odisha don't know how the Koraput is. Like I traveled for the first time in 2017 December, Xmas, similar day, winter day, and then I found it exotic. Only thing, if you love a girl after you are married, the definition is different. So that happened with me. By the time I started loving Koraput, I was married to Cuttack. I had my family. I had my friends, I had my interaction, and mentally I had decided to settle over there. So that's why I could not change my mind and I had to go back to the place where I had to, maybe it was destiny's desire. I reached, I took over and COVID came. And the very cruel COVID took many lives and we have worked day in and day out. I was in the technical team. I trained people, doctors from even this district have traveled. We maintained the dedicated COVID hospital and many things in capacity building, many things in the webinars, deciding the regimens and then training the young doctors. I don't know how 2 years passed. 2020 and 21 passed in that. And after I reached and just started working with my postgraduates, the most important thing I was missing here is my postgraduates. You see, for a teacher, the faculty knowledge, if you cannot transmit, that's a deficit. And staying in medical college with a heavy heart, I tell, has no more attractions. You see so many pressures, so many challenges, so many difficulties around, and lucrative offers from the other sector. I tell, for people like me, the only attraction are you all, my students. Unfortunately, when I joined, there were only one batch of students in 2017, and then when I left, it was increased to 2, and third batch were just joining. And I'm very happy when I learned from the leaders of the Students' Union that the 5 batches complete. You have 575 students, first year, second year, third year, fourth year, final year, it's complete. And after the first batch gets the MBBS degree, this is the time to apply for the post-graduation, and I'm sure our able administrators will do that, and we'll wait for the day that you will come as proud postgraduates in different departments to build your specialty, build your career. So that's about what I did with Koraput. In a similar night I entered, saw the light of Jagannath temple. I thought that I have reached the place of enlightenment. And you know, Lord Jagannath is the god of tribals. And then the Jagannath temple of Koraput means a lot to the people of the world. and the presence is felt differently. This is the first day launch I have taken the Prasad of Lord Jagannath, and I resolved that I'll work for the people of Koraput. And we tried to disseminate knowledge, teach every student, teach the people who are around, maybe paramedicals, maybe staff, in a technical way to improve their service to the patients. And though I was traveling, my look was to see the emergency duties, the OPDs and the indoors are maintained properly. I personally carried 3,000 books of my collection to open up a library in Department of Medicine, which still now stands a departmental library. We have started museum. We had started the special wards, and with the limited space available, we tried to organize the medicine service. And as Professor Biswal told, my emotion is with metabolic medicine. When I stayed here, I was attached to the ethics committee, Shah knows, and we started 2 big projects here. One is, it's a hilly area, so we wanted to see the iodine and the goitrous hypothyroidism in the people, school children. That's the project which SLN Medical College has given a ethics committee approval with collaboration of AIIMS Bhubaneswar, and till now we are continuing. The second project we started in the newly detected tuberculosis patients. We tried to detect the glycemic intolerance. Those who develop tuberculosis, they develop chances of diabetes by glucose intolerance. That also we started in the department when I was there. These are the 2 projects which we are still continuing. It started in SLN and continuing in SCB. We have more than 200 patients, and then midterm analysis of data is already there, recognizing SLN Medical College. And coincidentally at that time, SCB Medical College Ethics Committee license had expired, and we had a valid license for SLN Medical College Ethics Committee. My purpose of saying that don't never bring this thought to your mind that you are at a peripheral medical college, a tribal medical college, or at a remote medical college. Never ever. I joined VSS Medical College, Bulla, way back in the 80s. And I had a rank of 16. I didn't know, because I am born in Balangir. My school and college is PRI School, Rajendra College. I didn't know any medical college that's MKCG and SCB beyond VSS. My only choice was VSS. And with a 16 rank, I could have qualified any medical college then when I joined VSS. And proudly we read there, and my teachers, till I remember, have given their best. And what I am today is because of my teachers who have guided me through 6 years in VSS, which would not have been possible in other medical colleges. We failed to do that. We failed to teach our students at SCB. That's what I am missing in the COVID work. After I became the HOD in the administrative work, after we took more responsibility, there is less time to spend at the bedside. I was reading William Osler yesterday. If you go back and read that man who started clinical medicine, he has told, don't get dipped into the books, go to the bedside. And learning which is done at the bedside is learning for a medical student, learning for a doctor. And I realized that's true. What you see in Google, what you read in your books, doesn't mean much to you. And if you go and sit at the bedside of the patient, what you see there and learn there is the ultimate learning for you, is the clinical medicine. and unfortunately it's losing its importance day by day, and people are investigation based. When somebody comes with pain abdomen, you tell go and get an ultrasound done. Somebody comes with a cough, you tell go and get an X-ray chest done. Somebody comes with a retching and vomiting, you tell go and an endoscopy done. This is not the way. You have to put your hand on the abdomen. You take a history, see the eye for the jaundice, auscultate the chest for a bronchial breath sound. And that's what we have learned, the clinical medicine. There is no CT scan, there is no MRI. Most of the biochemical investigations that you are sending now were not there. The diagnosis was not investigation based, it was clinical based from the history, from the clinical examination. Until now we practice, and perhaps we are the last generation practicing that. Because any young doctor coming across a patient advises a battery of tests and then deals with the diagnosis and the proper solution. So what I'll tell you, what you can do yourself with a stethoscope in hand, without any laboratory, without any backup, sitting in a OPD with a table and chair. You see medicine OPD, what is there? Table, chair, and a stethoscope and a doctor sitting. And daily here, at that time, were 150, 200 patients attending OPD. In SCB, around 1,500 patients attend my OPD. We see from morning to evening patients, and then most of the diagnoses are done in the history, done in the clinical examination, and little corroboration with the investigation reports. So never ever believe that diagnostic science is laboratory science. I think Professor Mahapatra may not agree to me, because pathology department is always gives the final diagnosis. We tell it CPC, clinico-pathological correlation, clinico-pathological symposium. And in CPC what we do, the final diagnosis is met. What clinician predicts, a biopsy is done, a immunohistochemistry is done, and a final diagnosis is done. And that was a comparison between the clinical sense and the laboratory sense. But your power is your knowledge, your diagnostic approach. So in a very nutshell, I'll show you few things which will make you a better human being, a better doctor, and will make you feel proud that I'm in the profession. Swami Vivekananda told, those who live for others, they only live. And those who live for themselves are more dead than alive. So this message gives that you are in a profession. Every time you live for others. A doctor lives for others. And when somebody is in distress, remembers you. If somebody is in pain, remembers you. And they come and try to get some solace, some treatment, some diagnosis for them for the future intervention. So, very meticulously you have to pursue, because we have the same heart, same lungs, same liver, same brain, same blood flowing in the arteries. We are one among them. We can suffer at any point of time. And when you are sick, you have a common cold at least, the feeling that you have, you are not interested in studies, you are not interested in the digital era, you are not interested in the food, you are taking rest and trying to get some relief of the disease. Every patient comes with that feeling, that pain to you. So first of all, I congratulate you for joining the profession, especially the first batch of the college who have passed and are in internship at present, whom we interacted. I have taken clinical medicine class of theirs and we try to teach them a little approach to the medicine. I congratulate them because they are at the front of interaction. They are pride of excellence. They were initiated by the Honorable Chief Minister himself. They went around. They were all felicitated. And an SLN was proud to host them. They were proud to be part of the SLN. That was the heritage. But subsequently you all joined, completing a batch of a college. And what I'll give you from my own life, from my own understanding, that in your curriculum, always think of becoming a dream healer, dream physician, and your efforts, your thought, your time, your studies should be devoted to acquire the skill, the art and science of medical profession to give best to your patients. It's not like any other profession that you learn, you deliver, and you earn. It's not like that. You have to develop empathy. You have to develop love. You have to feel for your people. And that's what will make you a very successful doctor. My experience, I'm in the profession for the last 25 years. I joined way back in 1997. And in 25 years, I realized out of a batch of doctors, we are making hardly 5 to 6 doctors clinically competent. But there are 20 to 30 doctors who are carrying the humanitarian feeling for the people. And in the long run, more than the clinically competent and intelligent doctors, people who had feeling for the patients, every patient had established themselves in the society, rose to above and made a good name and fame, recognized by the people. So more than your knowledge, you need knowledge, more than your knowledge, your compassion, the art more than the science is what going to make you a complete doctor. So I'll tell you about understanding a patient. Before, I'll be happy to take questions. If at all you have any challenge in medical science. When I was a student, I asked my invited guest that why I'm forgetting the things I read from my books. We're reading day and night. We're going to the wash bedside, but maybe when we remember, we're not able to reproduce all. I'm sure the same thing is happening with you all. You have read a chapter, suppose malaria you have read, suppose diabetes you have read, suppose bacterial meningitis you have read, and when you go further, you think that you read something, you're unable to recall. I asked that, and the answer I got, till now I practice with that formula to remember, I'll tell you. So understanding your patient, because all of you have seen one thing is common to you all, is dreaming to be a healer, dreaming to be a doctor, and the day you know the entrance result, the NEET result, that you are going to join the medical profession is the happiest day of your life, which has decided your profession. And even the day you get your degree, even the day you see your first patient, even the day you qualify for your post-graduation, even the day you get your job, will not be that exciting than the day you know I will be initiated to medical profession. That's what, and everybody has a dream of becoming a doctor, means dealing your own patient. And I'll tell what you need to succeed as a successful physician to give best to your patient around. So next, I'll give you A, B, C, D, E, F, G, H formula. As usual, I have till Z, but today I'm stopping at H, looking to your series of events. I'm sure you're keen to see the musical night, the stand-up comedy, and I'll not take much time. This is something to introspect. A, B, C, D, E, F, G, H. I'll just take 1 minute for each before I give you some formulae for your patients, understanding your patients. A for availability. Remember this. Always A for availability. If you are not there, you have lost the opportunity. The success belongs to the people who are ready to perform when they are wanted. You have to be available. So availability near the patient, availability near the examination, availability in the campus, availability in your ward, availability in your class, availability near your teacher, availability near your family. So never hesitate to do that. It's a very bad temperament. People are not coming to ward nowadays. You see, you be keen. Sir, what is this sign? What is this patient is suffering from? Everything that you see at the bedside has a meaning for an internist. So be available to make you wiser every moment. Next, behavior. Remember, you have got an opportunity to become a doctor. It's not that you have snatched it by the dint of your ability, your money, or your manpower, the power of your family, or a blessings from the above. It's not that. You have been chosen to become doctors in this society. So don't look down upon anybody. And when a sister is there, a paramedical is there, a lab person is there, an educator is there, a doctor is there, a hospital is there, a laboratory is there, at the center there is patient. We all are working for the patient. Never look down upon a patient, never misbehave them. And leave aside patients, your friends, your colleagues, your teachers, every man of the society. You have to respect. Humility is the first quality. Be humble. If you want to grow a single quality, grow humility. Rest all will be acquired. So behavior has to be at your best. You may be tired. You may be working for 72 hours. I was a resident in AIMS. And AIMS residency is 72 hours. You will all go and work there. With a pacer, we work. Only biological breaks are given. We don't take bath. We don't go to mess to take food. We take some snacks in the canteen. We work for 72 hours. You must be losing your patience when the patient is asking silly questions. But this question may not be silly. That can contain many meanings. And you have to be committed to that. Behave well, behave well, behave well. Next, curriculum. Nobody can be a good doctor without a mastery on the curriculum. Read your books well, right from anatomy to SPM. See your patients well, right from medicine to ENT. You have to know theory, you have to see practical, and there is a very good coherence and balance needed between the knowledge and the clinical implication of that. So remember, what mind doesn't know, eyes cannot see. If you know something, you know jaundice. If you see, this is jaundice. It comes. So don't think that is not useful. Whatever time I have given to my books, whatever I read at any point of time, maybe in library, maybe in friend's room, maybe from the teacher's mouth, maybe at the bedside, everything is useful till date in my life to diagnose, to treat, and to teach. So I tell, everything in front of you is important. It's all how much you can grab. Don't waste time. Anything not needed, anything silly, anything can be done without doing that. Don't waste time. Utilize your time, because we are keen to read and teach. We are not getting an opportunity. Administration is taking away our possibility of teaching. Read, read and read, and ultimately it's knowledge which will help you to deliver, or else you'll harm yourself, you'll harm your family, and your patients will outright reject you. I'll show you a dictum. When you are examining a patient is examining you. D, divine grace. Many people may not agree, there may be atheists amongst you, but I have seen, alone I am very helpless. So when I fail, I surrender near a power. I don't tell Jesus, I don't tell Vishnu, I don't tell Allah. I don't tell any religion, any particular sect, any goddess or any faith. There is a divine power. The way a human body is constructed. You you analyze yourself. You have read anatomy, you have read physiology, the way body is structured and functioning. You do a painting and tell that I have done this art. And such a beautiful creation you are. There is no creator. There is a creator. There is a creator. And there is something the creator's desire is implemented. So you are a doctor by creator's design, and if you fail, you seek divine help, and it comes. I talk with my God like I am talking with you. It's so realistic, it's so practical. Only thing, your faith is required. You have to faith, you have to keep faith on your own strength, because our power, our knowledge, our action is limited. I call it life limited. Like a tiger in the Nandan Zoo, limited. He can jump around, but after certain boundaries cannot go. Tiger in the jungle, go to anywhere he like. So you are a doctor with limitations. God has not given you a life unlimited. It's a life limited. So when you fail, in the interest of patient, seek divine grace, and it will come. It will come, I am telling. And you will also realize that miracle happened, which was not possible by science. Miracle happened. And it happens when you are 100% true, 100% honest, and 100% dedicated to patient's care. You are not doing to show something. You are not doing to hide something. It's your dedication, your aspiration of achieving something for your patient, your rejection of the false powers, and your surrender near the divine strength will make you an extraordinary healer or physician. E. Extracurricular. A doctor with, that's what you all love. You love to be a poet, you love to be a sportsman, you love to achieve something beyond your curriculum required. If you are a leader, if you are a painter, if you are a debater, if you are a person with sports, with different extracurricular activity, you have an edge over others who don't have it. That gives you the ability to manage yourself, manage your institution, manage your friends, and by that you gain more in life. Keep it up, but not compromising the curricular activities. Curricular and extracurricular should go side by side. You must know your curriculum, then go beyond for your extracurriculum. Next, fluency. I am here today because I can speak. I have many friends, I have many teachers who are better than me in the knowledge, in the ability, in their dedication to the profession. They cannot speak out. Because I was speaking, I am a Vice Chancellor, Cup winner, debater. I know the language, I know the modulation. I can speak it out to you. Remember, oratory is important. What you speak to your patient must leave an impact on them. What you speak to your teacher must give them confidence he is a good student, he has a grasp over the science. You may know many things, but if you are unable to speak it out, then you cannot achieve. The confidence in which you are answering, the confidence in which you are approaching, the same thing will be achieved by somebody and rejected by the somebody. You see, you don't have a ID card to enter the airport. You are reluctant to approach the security. You cannot enter and miss your flight. And somebody smartly presents that, can I have a soft copy, or can I ask my friend to send? And the security is convinced that you are a genuine person, you go and board your flight. That's the difference. First, make your character, build your character on the truth, honesty, discipline, and have the courage to go forward to achieve for you, your family, friends, and society. You must be able to present yourself. That is, if you're not acquired that, do that. Speak to the pigeon sitting in the hostel roof. I was doing that in the medical hostel. I started telling to the birds, to the trees, to the pigeon. When I started speaking, public speaking, I tried to do that. Do that, and you must be able to open up and speak which you want to speak. G is the ground reality. Suppose you are thinking Harvard is the best institute. Suppose you are thinking Oxford is the best institute. SLN cannot be Oxford. We thought that for years together, and the Britishers ruled us for 200 years. Today we thought we are better in our way, and the Indian is ruling the British. That's the story. So we are different. Our body is different. Our mind is different. Our action is different. Our dream is different. So take yourself as a different person, and your achievement will be fit to your need. We need not go by the world the way it shows. So ground reality. You are at Koraput, you will work like a person at Koraput. And it's not that we'll quote somebody from United States and demotivate, demoralize others. Last is the honesty. I tell you, till now, in my life I have felt honesty is the best policy. In examination, in studies, as a clinician, as a husband, as a father, as a friend, honesty is the best policy. And if you are not honest, the God within you will not allow you to perform and shake. And this A, B, C, D, E, F, G, H is what the 8 things I put forth tonight. After you relax, after you dance, after you just listen to the comedy, spend 5 minutes. Can I practice that in my life? And you'll have a turning point. What you have learned till now may not stay, and you'll have a different direction to your life. That I have seen, I have achieved, and I have encouraged many people to do that. We do that. Nowadays we have induction in the MCA syllabus, but time was there, nothing was there. We used to motivate people, and till now I have been 25 years, I have students, abroad students in other hospitals, in other cities, they come and tell, sir, the word you told had changed me, and I'm here practicing hemato-oncology and practicing the interventional radiology. So people have changed for better. You can grasp your subject well and get achievement. Quickly I'll show you some patient needs before we stop. Next. The patient is examining with you when you are examining the patient, as I told you. Everybody is a human being. He has judgment, he has assessment, he has knowledge. Suppose you are not confident in your approach, you want to refer a book. If you are confusing between 2 diagnoses, you are not able to interpret a report, patient can easily catch it. The doctor is not confident, immediately he will seek another doctor. So remember, you are treating you are a human doctor. You are not a veterinary doctor. So you are treating a human being, and they are skilled, and at times they are skilled more than you, to assess your confidence on your profession to treat them. Next. Listen to the patient carefully. Everybody needs to be listened. This is as a physician, this is as a internal medicine fraternity, I want to tell you, the art of listening is much, much, much better than art of speaking. The secret of making a clinical diagnosis is the time spent near the patient and listening to the patient. Remember, the patient has suffered. The patient had the challenge of the disease, and let him speak out what has happened to him. He will prompt the diagnosis. Let your patient prompt the diagnosis in front of you. Next. The relevant physical examination is a must. Now I have seen students not touching the patient. People are putting note in the ticket, not seeing the pulse. You see how much of finding is there in palpating a pulse. You cannot know unless you physically have palpated. The relevant physical, you see, it's not possible to examine head to toe. But relevant physical finding is a must. Anybody having cough, you must inspect, palpate, percuss and auscultate the chest. Anybody having a headache, you must see for the signs of raised intracranial tension. You must feel for the bradycardia, see for the extension of plantar response. That is clinical medicine. So, listening after COVID, there is a dangerous trend of just listening the patient, that too incompletely, not allowing him to complete the history and start writing prescription. Please don't do that. Listen the patient completely, examine the relevant things. Suppose a diabetic patient has come. You must see the fit, there is an ulcer. You must see whether there is a neuropathy. You must have a fundoscopic examination, there is retinopathy. You must see the heart, there is a coronary artery disease. And you must see whether there is a possibility of diabetic kidney disease. All possible complications you have to screen and you have to achieve. Next, always be rational in investigations. Another dangerous trend in the present generation is writing from A to Z. You are writing a MR scan, you are writing a colonoscopy, you are writing a flow cytometry, you are writing anything and everything under the roof. You don't understand the poor villager has sold the property and has come for treatment under you. You need a DC examination, advise a DC, and you must be able to justify why you need a DC examination. Your clinical sense should be that strong. Don't do a to Z investigation, and good that in BSKY we are able to afford give our patient best of the taste, but that is not for everyone. Doing a MRI is not for everyone. People are coming and approaching. Sir, please advise this. I want to get this. May not be needed. You spend 5 minutes clinically, may be more relevant than a MRI investigation. Next. Necessary medications before investigations. Another dangerous trend I have seen in the residents and the students, that patient is frustrated, come helpless to you. You write down A to Z investigation. You didn't attempt to give a first aid. You never cared to see a blood pressure. You never thought of seeing the saturation and giving a oxygen therapy to the patient and send the patient to the investigation. He goes to lab and dead there. So assess clinically, give first aid, which is more important than testing the patient. Unless knowing about the patient, I'm not taking the name, I'm giving an example. A Dr. Sean met with an accident in the VSS Medical College, found, declared to be vital stable and referred to SCB Medical College. From VSS Medical College, and in the Redak hole, the only son of a professor of surgery is dead. People don't know why he died. Poor clinical assessment. VSS Medical College could have given the best of the treatment, and the doctor couple lost the only son for their life. And the patient is not always the patient. At times the patient is a doctor or a doctor's family. That you have to realize. So you must think of medication before you investigate. Suggest hospitalization, there is an indication. The most important, you have to suggest hospitalization. You see, clinically, single most important indication for hospitalization is respiratory distress. COVID has taught you. If somebody has a respiratory rate more than 30, if somebody has a saturation less than 90, if somebody has Sano's lips, detect and intervene, give oxygen, transfer to ICU. So in your quick post-admission round, have a quick assessment looking who is a stable patient can be taken to diagnosis and who is a patient who can be taken today for a intervention or the life support. That shapes a life, and without doing that, the patient may lose the life. Next. Attend in time and talk to the patient party. If most of the fightings in the medical campus, the doctors are beaten to death in many big medical colleges, and we are in the crossroad. We doctors are in the crossroad. We are no more gods. Time was there when people were worshipping doctors as God, as the incarnation of the God. Now they are cross-checking your prescription in foreign countries. They are suing for the compensation, and now fatal, brutal attack on the doctors in the casualty and the duty place. Take time, attend in time, and talk to the patient's party. Suppose you are asked, you are called for, don't delay. I told you, go and see your patient, and then call the patient's party and tell that this is the state and he can die any moment. I'm shifting to ICU, I'm giving this oxygen, I'm giving this saline, but patient is fatal. If you have convinced that, if you have attended the patient, you have put a note, you are shaved, and the patient's party will think, no, doctor has done his duty. Most of the cases we have seen the doctors are beaten are instances where patients are not attended in time, and patient attendants are agitated that we are neglected and we cannot achieve. Next. Take help of the concerned specialty. You are a physician. You think that the problem belongs to a surgeon, a gynecologist, a interventional radiologist, a super specialty like urology or plastic surgery. Immediately suggest this is an era of specialty and super specialty. Don't think that everything you can treat. Refer the patient at the earliest available opportunity to get best out of them. Next. Refer to the higher institute in time. You refer to MKCG or AIMS or SCB. You know that this is not done here, patient is sinking. Till last moment, don't keep it. I called Honorable MLA MLA Jaipur to come to today's meeting. His own brother-in-law was referred, and in the same ambulance came with the dead body, and he was in the funeral ground. So that can happen to anybody, referring at the end helplessly, and that doesn't have any meaning. I told you, a doctor's son died on the way without proper intervention. Next. Confidence of the patient party. You must talk to the patient's party, and you have to win the confidence. You tell that these are the facilities available. This is the probable diagnosis. We are working with this much of evidence. We are strong in this. We are weak in this. Patient's party wants to take to a corporate hospital, to a higher hospital, well, or else patient's party entrusts you to treat, you treat. Or else you invite problem for the future interactions. Next. Communication, I have already told. Every step you are drawing the fluid, communicate. You see, many people think that you have taken the kidney in the process of treatment, and you see the news, the doctor was treating for a gynecological problem and the kidney was snatched away. Many people are shocked whether they are treated in the proper hand or not, proper intervention done or not. Communication at each step, not only verbal, written communication. Write a consent, get the signature of the patient's party, and that's what is going to help you legally. The time is not far. In UK and US, you go to a clinic, you come out, in front of the clinic you will see a signage, you have consulted a doctor just recently. For any legal assistance, contact, there will be a number given. So your advocate brothers, your legal friends, they are very keen in taking your patients and giving them the evidence against you. And if you cannot prove your treatment, you will be taken to the court of law, and you don't know what hell will happen to you and your family. You would have earned 500 rupees by treatment. You will end up paying 50 lakhs in fine. Next. Written consent for the important intervention. I told you all. Any intervention you are doing, high risk intervention, ICU, ventilators, thoracic drainages, any intervention you are doing. Because when you are doing a tracheostomy, your patient will tell that you did some procedure and my patient died of respiratory distress. Next. I already told you, be available when needed. That's the thing which most of the time put doctors in problem. Next. Behave them well. Very important from the B, I have told you. Next. Be truthful and rational to win the trust. If you are truthful, even if the patient cross-checks, goes to Google and checks the fact, will be convinced that the ultimate is what you have told, operation is required and this center is the best for the surgery. If you have told something wrong beyond profession, he'll detect it and he'll see you out. So always be updated in your information, be truthful and rational to win the trust of your patient. Next. Protect yourself when it's adverse. That's very important. You see that patient's party is not able to accept you. Patient belongs to the local group. So that's very important when addressing a patient's problem. When you're interacting or advising a patient, always think of a possible danger from the patient's side. And when you have failed, it's important you take help of your teachers, take help of your friends, take help of the social contact and protect yourself. Next. Don't face them alone when they're agitated. You see, when somebody loses some relations and they don't have a brain then, they're decorticated. They act at the spinal level. So somebody has lost a relation in the hospital. Don't show that you are courageous. Go in front of them and come injured. Never do that. It's very important to leave them there with the emotion and time will heal them. Next. Do proper documentation, I told. Next. Be extra careful when it's a sensitive case. You'll have call from your teachers. You'll have call from the district administration. You'll have call from our journalists. And when somebody calls, when somebody is known, when somebody expects that he'll get extra care, give that. They are sensitive cases, need to be dealt specially. Next. Detect problematic cases in round and talk to them. In a quick round, suppose you go, there are 100 patients. You are not being able to manage because of the overload. Just have a quick overlook, screen, and then decide when you'll intervene. Next. Take them to confidence. I've already told you. Next. Next. Be compassionate and keep humanitarian approach. I've already told you. After all, everybody is a human being. If you have behaved them well, you have talked shines, you have planned for the best. That is what Supreme Court tells today, that if the approach is for betterment of the patient, whatever a doctor does, he cannot be sued. It's the better interest of the patient. In trying helping out a patient, there may be some harm, but it is not equivalent to kill the patient. Next. Design an uncontroversial personality. Very important. You are a disco dancer, at the same time you are a doctor. So society looks into your dress, uniform, your friends, your family, your activity. You have to build in such a way that your activities, your philanthropy, your achievements, your recognition, your personality should give confidence to your patient. So always get involved in similar activities so the patient will get a boost. My doctor is a humanitarian, my doctor is a leader, my doctor is an administrator. Next. Never work for money. You see, one thing I must tell you, I distribute sweets. I see that people are well treated. I spend, even if I don't have money, with the same one intention, I don't work for money. I work for the patient, I work for the profession, I work for the cause. I don't work for the money. And those who work for the money, their entire approach is different. Unfortunately, corporate hospitals and the setups have now a financially motivated approach. That's what Because doctors have lost their social respect because of this business attitude towards the patient and towards the cause. Time was there, doctors were working beyond suspicion and society was respecting beyond doubt. Next. Always have patience in every opportunity. So this is the opportunity given to you, I told. You are all doctors. You are selected to be doctors and try to help everybody you come across. Next. Aspire to help them, reject your motives, surrender near the divine and the treat. I have already told. Once you are seeking the divine grace, you are the most powerful physician on the earth. Your knowledge, your power is limited. So let the big power be with you. Next. Pray in crisis and work intelligently, and your prayer will be replied. My own feeling, every prayer put sincerely is replied. Pray for your patients, pray for your students, pray for your cause, and the goal will be achieved. Next. That's what we have completed the series of advice. So, good that I have completed my list in front of you. I didn't want to take you to the academic jargons. I didn't want to take you to much advice. Simple practice points. We tell in practice points. For treatment of dengue, for the consultants we tell 1-1-1-1. See the platelet, see the rash, ask for pain abdomen, see for the dehydration, jaundice and renal function. Practice points. So similarly we have given you the clues for the best studenthood to achieve the knowledge and make yourself successful doctors. Finally, again I thank you for inviting me in this occasion and tell you from my personal experience that whatever the mind is so strong, whatever you will want to be, you will be able to achieve. Mind is that strong. You know about pseudosciasis. Pseudosciasis is pseudo-pregnancy. If a lady desires to be pregnant, there will be no menstruation. There will be abdominal girth will be increasing, and he'll have all signs of pregnancy in him, designated as pseudosciasis. Mind is that strong, that powerful. So I don't believe that something is not possible at Koraput, at SLN, or at your level. So dream big. If you see big, if you dream big, if you think big, you can be big. No, nothing is a barrier, sky is the limit. And I wish all of you will come up successful, achieving life, and for any help possible through me at any juncture, we are always there. All the best.
Thanks a lot, sir. Your words were not just words, they were blessings for us. And those practice points that you said, the mnemonic from A to H, whatever you said, sir, we all promise that we will emulate it in our lives. Each and all of us will carry it with us till the end. And sir, the fire that was burning in us after the clearance of our entrance exam, it was a bit dimmed down, but sir, after your words, that fire has been rekindled again, and I wish that fire will burn till the end. And once again, sir, thanks a lot. Well, now I request respected Superintendent Sir, Professor and Dr. Sitaram Mahapatra Sir to please come and address the students.
Respected Dean and Principal Prof. Vishwal, my colleague Professor Panda. Jayant has spoken a lot of very important things to you in this evening as the speaker. I agree with him fully that there are many things beyond the textbooks of medicine that we have to learn with experience. I can just tell you one thing, that being medical students sitting here in this auditorium itself proves that you are an intellectual class from the society chosen to become doctors. So this confidence itself should motivate you, should inspire you, to face any trouble, any problem, any hardship, to go through this ocean of medicine, to train yourself to become doctors, specialists and super specialists in the future. And I am sure with your devotion, dedication, place is not important, as Jayant said, let it be Harvard or let it be AIMS or let it be SL. The individual is important. I have seen students coming from new institutions have cracked AIMS, PGI, CMC Velo and all other previous institutions with first attempt the post-graduation and also for super specialty. And even the best so-called institutions, products or the students could not get into the PG and super specialty in the entrance exam. So institution is not that important. What is important is your personal devotion, dedication and your inspiration and hard work with a motivated mind will make you reach any damn thing in this world. Nothing is impossible. Everything is possible. And I'm happy to see that the first batch of interns are doing really well. They are doing very hard work. And I'm sure most of them will get the NEET PG. I'm sure they are an excellent batch. And I'm sure next NEET PG, most of them or maybe all of them, I don't know, I wish to see all of them qualifying the NEET PG with the best plans possible. And I'm sure it will happen because I know that they are excellent. And all of you, the juniors below that batch are also excellent students. So my best wishes to you all for a bright future and thank you so much for inviting me.
Thank you so much, sir, for your words. But sir, now I would request all of you a little bit more of your time so that we could felicitate the winners of various competitions. And I request the some members of our union, Students Union, to come and to proceed further.
Good evening, everybody. So now we'll begin the award ceremony. First up is Rangoli competition. The second runner-ups are Himanshu and Sambit from the Atrayans and Pragya Parmita and Preeti from Atrayans. The runner-ups are Swaraj and Suprajit. Please be seated near the stage. And the winners are Dr. Sonali Didi and Dr. Lokomudra Didi.
And the winner is Ankita Das from Esclipse.
Next up, we have the extempore competition. Coming in at second runner-up position is Someraj Acharya. The runners-up is the Swatishri Pradhan from Athens. And the first prize goes to Ishika Sahu. Next up, we have the painting competition. Coming in at third, we have a joint between Manjeet Bhoi and Anusuya Biswal. And the first prize goes to Rajesh Kumar Gowda.
And the first runner-up is Kumar from Union. And
now we would like Next up, we have the tripling competition. Coming in at third is a joint between Geetanjali Tudu and A. Sachin Kumar. The first runner-up prize goes to Swastitapa Narendra. And the winner of the tripling competition are Swaraj Swarup and Roma Rani.
now moving on to the bookmark. The second runner-up part is a tie between Swaraj Swarup and Swatishri Pradhan. The first runner-up is A. Sachin Kumar. And the winner is Meghna Panda.
Next up, we have Lensomaniacs. In the theme Color of Life, the third prize goes to Saswat Pati. The first award goes to Swastitapa Narendra. Next up, we have the competition Digi Art. In this In the theme of doodling, mandala and scenic, the third prize goes to Abhishek Swain. Now announcing the results of the chess boys. The third prize goes to Akash Chandra Nayak. The second prize goes to Siddhipriya Mishra. And the first prize goes to Oroshi Sahu.
Now moving on to shot put girls. The third prize goes to Abhilipsha Mohanty, Didi. The second prize goes to Rupali Padhiyari, Didi. And the winner is Lipsa Chen.
Now I would like to request Dr. Sitaram sir to come on the dais and award the rewardees. Announcing the result of the shot put boys. Coming in at third is Daya Sagar Chaudhary. The second prize goes to Manbesh Badasek Sai. And the first prize goes to Ajit Singh.
Now moving on to discuss pro girls. The third prize goes to Rupali Padhiyari, Didi.
Now on to the discus throw of the boys. The third prize goes to Ajit Singh. The second prize goes to Badal Sahu. And the first prize goes to Abhijit Acharya.
The second place goes to Supriya Raisa. And the winner is Anjali Soni.
Boys race, coming in at third, Subdarshi Devashish. Coming in at third is Satish Sahu. Second is Subdarshi Devashish.
Now moving on to long jump girls. The third prize goes to Manika Namo. The second position is a tie between Sushri Patri and Sangamitra Bhuya. And the winner is Ritu Ranjita Rai.
Now on to the result of long jump boys. Coming in at third is Manbet Badasek Bhai. Second is Siddheshwar Murmu. And first is Badal Sahu.
Now moving on to marathon, the third position is a tie between Kumar and Siddheshwar Murmu. The second prize goes to Ashwini Kumar Jayant. And the winner is Tushar Mangraj Bhai.
Bro, the runner. 25 kilometer marathon.
Thank you. I thank the esteemed guests to felicitate the winners. Now I request them to come down and be seated and enjoy the program now on.